Well, a scary place looking even scarier tonight.
We are talking about the state hospital that treats some of our most mentally ill. And now there are claims of a hostile workplace from injured workers fighting to get medical treatment after suffering at the hands of violent patients. KITV4's Catherine Cruz joining us now with those latest developments. Catherine.
Well, it has been about 2 months since the fears about safety first surfaced. Since that time, labor officials have launched a workplace safety probe, and now new charges of nepotism and fears of retaliation have surfaced.
I got knocked out a few times. One of the patients actually said that he was going to break my neck.
One by one, workers told their horror stories. Their doctor, who said he treated 6 hospital workers over an 8-month period, felt he had to say something before someone died.
Something has to be done because we're going to have a death, and whether it's a death of an injured worker or of a worker or another patient, this is beyond just a basic level of assault.
Health officials laid out the challenges of a growing and more violent and psychotic population of patients, and lawmakers grilled them about short staffing and training programs. But there are new claims of nepotism and promotion of untrained staff, and letters written by workers too afraid to speak publicly, and others who say they fear retaliation from mid-level bosses.
I did my job. It was shown I did my job, but I got reprimanded and I got moved off the unit.
There are so many people who are probably silently suffering in that facility because they failed to reach, out or have been threatened to reach out, that I think there should be some screening mechanism put in place to try to address the workers who are suffering.
This thing is a can of worms that is going to be very difficult to unravel. It's multifaceted, and I think some very candid information is going to come out, but the information is in writing, and I'm going to restate that. And that's why a subpoena is necessary.
There is growing concern over a disconnect over how violent patients are treated in prison and at the hospital, in shackles and under heavy security, and then let loose at the hospital with little for staff to protect themselves.
I think the discussion we're going to have has to involve not only the treatment and the handling of these patients, but also the laws that govern the 2 departments.
Whether or not we have to build a forensic hospital to both put the people who are the greatest threat to society into care there while we protect some of these workers.
Now, lawmakers plan to ask for subpoena powers on the first day of the legislative session. They expect the hearings to last for at least 2, maybe 3 months. Back to you.